What are gentle warts and do gentle warts go away? We're going to talk about a topic that's often misunderstood and stigmatized, gentle warts. What are gentle warts? Gentle warts are a common sexually transmitted infection that affect both men and women. They are caused by certain types of virus called the HPV, the human papilloma virus. They're classed as an STD, a sexually transmitted disease, or sometimes called a sexually transmitted infection. This is because this virus usually spreads through skin-to-skin contact during sex. So what are they? They're small, fleshy bumps or growths. They generally appear around the inside of your vagina or around your vagina, the penis, or your anus. If you're worried about gentle warts, here's some things you should know. Number 1, they're really common. The CDC says around 1 in 100 sexually active adults have it at any given time. Number 2, they're only caused by certain types of HPV. There are more than 150 types of this virus, and gentle warts are caused by 2 strains of it. So having HPV infection doesn't mean you're going to develop gentle warts. Number 3, it is important to get the right diagnosis. This is best done by a doctor. Number 4, if you do get them, there's lots of different treatments out there for you, and I'll go through them in this video. What causes gentle warts? Well, HPV is a very common virus that can be transmitted through sexual contact. Risk factors for getting HPV infection include multiple sexual partners, having unprotected sex, and having a weakened immune system. So what are the signs of gentle warts? The most common symptom of gentle warts is the appearance of small, flesh-coloured or grey bumps in the genital area. The warts can be flat or raised, they might be clustered together or spread out. Some people may experience itching or burning or discomfort in the affected area, while others have no symptoms at all. It is important to note that gentle warts can take weeks or months or even years to appear after you've had an infection. Here's what to look out for if you think you've got gentle warts. They usually start off as small bumps around 1 to 2 millimeters in size. You may only have one gentle wart, or you might notice multiple bumps. They may look different or vary depending on your skin color. Some people, they notice them as flesh-colored, other people notice them darker or even white. They can be smooth or rough. People often describe them as looking a bit like mini cauliflowers. They can change size, shape or color over time. Some women notice increased vaginal discharge. In rarer cases, they can bleed, and this usually happens from friction, like wearing certain clothes or during sex. Here are some pictures of gentle warts. Why do gentle warts itch? Well, for most people, they don't experience them as itchy, but some people do find them itchy. The exact reason why gentle warts itch is not fully understood, but it's thought to be related to your body's immune response to the HPV virus. HPV infects the skin cells of your genital area, and your immune system responds by sending immune cells to the area to fight the infection. This immune response can cause inflammation, irritation, and can sometimes be experienced as itching. Getting rid of warts and do gentle warts go away? There's currently no treatment for the warts-causing virus HPV, although your body usually clears this up in around 2 years for most people. But you can have treatment that gets rid of gentle warts. Here's the lowdown. The right gentle wart treatment for you depends on factors such as the size, where they are, and how many you have. Treatments can take several months to be effective and don't always work. Or the warts can come back. This is because the treatments target the warts, not the HPV virus. You may prefer to have no treatment. About 30% of people have noticed that their warts go away on their own within around 6 months. Wart removal creams. The most common creams you apply on your skin are called. These can be used to remove visible warts, but they might not cure the underlying HPV infection. It usually involves applying the creams onto your skin for around 4 weeks and in some cases longer periods. These creams need prescriptions from a doctor. So you might be wondering, what other treatments can your doctor do apart from give creams? Well, number one, cryotherapy, where your warts are frozen off using liquid nitrogen. It is usually the first treatment option if you're pregnant. Number two, laser therapy. With this one-off treatment, a beam of infrared light is used to target your warts. This is generally best for larger or more extensive warts in difficult to reach areas. Number three, electrosurgery. This is a one-off procedure using electrical current to destroy your warts, and is recommended if you have external warts. It can be painful, so you might need local or general anesthetic. Number four, topical acid treatments. These acid treatments can be applied directly to the warts to burn them off. It's a safe treatment and usually involves having a treatment once a week for around 4 to 6 weeks until the warts have disappeared. Here are some self-care tips for genital warts. Number one, don't use shop-bought wart treatments on your genital warts. They're not suitable for the sensitive skin in your vagina, vulva, or your anus. Number two, avoid perfumes, soaps, shower gels, and bath products when you're having treatments for warts because they can further irritate the skin. Do genital warts cause cancer? Genital warts themselves don't cause cancer. However, the virus that causes genital warts, which is a type of HPV, can cause changes in cells that may in time lead to cancer. There are more than 150 types of this virus. The type of HPV that causes warts are not typically associated with causing cancer. HPV strains 16 and 18 are more associated with causing types of cancer. If you leave warts untreated, they can grow in size and number and may be more difficult to treat. Additionally, individuals with genital warts may be at higher risk of acquiring other types of sexually transmitted infection, which can also increase your risk of cancer. Prevention. The best way to prevent genital warts and HPV infection is to practice safe sex. This involves using condoms, limiting your number of sexual partners, and getting vaccinated against the HPV virus. Are genital warts contagious, and how do they spread? Genital warts can be spread from person to person, usually through sexual contact. This includes vaginal, anal, and less commonly oral sex. Genital warts versus genital herpes. What's the difference? Genital warts and genital herpes are both sexually transmitted infections that cause discomfort, but they're caused by different viruses. Genital warts is caused by HPV and genital herpes by HSV, the herpes simplex virus. It is important to see a doctor and get the right diagnosis because they have different treatment options. What are the best ways to tell them apart? First, by look. Warts are small, flesh-coloured or grey lumps in your genital area. The warts are generally flat or raised, but they can also be clustered or spread out. Herpes usually present as painful blisters or sores on and around your genital area or your rectum. These blisters can burst and leave painful sores that might take weeks to heal. Time frame. Warts usually grow over weeks to months. Herpes usually lasts around 5 days during an outbreak, but it can take weeks to heal. Genital herpes usually also present with flu-like symptoms such as fever and body ache during an outbreak. And lastly, pain. Herpes are generally painful. Warts don't generally hurt as much and are quite firm in comparison. So in conclusion, genital warts are commonly sexually transmitted infections that are caused by HPV. If you suspect them, see a doctor to get the right diagnosis and treatment. And lastly, practice safe sex and get vaccinated against the HPV virus, which are the best ways to protect yourself. Thank you for watching.